What does it take to lead innovation that could change how millions of people see the world? Literally. From the battlefield to the boardroom, today's guest has made a career out of turning vision into reality, both in business and in life. Welcome to Industry Ignited, the show that explores how bold leaders are transforming industries through vision, grit, and innovation. I'm your host, Dr. Leeanne Aguilar, and today I'm honored to be joined by David Esposito, President and CEO of ONL Therapeutics. David is a decorated combat veteran turned healthcare leader who has built and scaled multiple life science companies. Now at ONL Therapeutics, he's leading breakthrough work in retinal protection, developing the first therapy designed to prevent the death of critical retinal cells, a root cause of vision loss and blindness. David, welcome to the show.
Leanne, thanks for having me. Excited to be on your program.
Thanks, David. Now, you started your career as a combat leader in the U.S. Army before moving into healthcare. What lessons from your military experience shaped how you lead today?
Well, that's a great question, and we probably could have a whole podcast on that if we wanted to talk about it. But I think as a couple things I would say that I think have tied those experiences in the military to here at ONL or leading biotech companies. I think one is it is leadership. Leader needs to set the example, set the pace on energy, enthusiasm, belief in the impossible. That's setting the example is a critical role, whether it's a leader on the battlefield or in the biotech forum like I am now is really important. You have to set the tone in that example for sure. And then I think the other one that's very important and relevant to both my military and biotech experiences is that you have to be prepared for the unexpected. The base plan never goes together as smoothly as you think it will be. So that really preparing for, but then also handling changes or new data points in my current world, new data points on the battlefield. You have to be prepared for that. So I think those are probably the two big ones, really, setting the tone, setting the example, and then ultimately being prepared for the unexpected because it happens more than we think.
Oh, I totally hear you, right? I mean, business can be similar to a battlefield in that regard. You never know what's going to happen, and being prepared to shift, or the word these days, I guess, pivot at any time is essential, and being okay with change, right? Being just not resistant, but ready to step in and go along with the change. So after years of success in big pharma, you made the leap into entrepreneurship. What drove that decision, and what did you learn about yourself in the process?
Sure. No, that was a big decision. I wrote a short book on that one called Looking Back. No, I think it was a really big decision. I think when I boil it down to the real specifics, Leanne, it was about my desire to learn and grow. There's probably a very similar journey that many people may have with a big company, that at some point you reach a point where maybe you're just trying to make the big machine run a little smoother and more efficiently. And I was desiring, a different pace for my own learning and growth. That was one primary reason. I think the second one, in a few of the various roles, I was 15, 16 years in a large pharma company, was that I began to see a pretty significant shift in the marketplace where innovation was really moving beyond the large companies into more early stage privately held companies. And I found that real purposeful to be on the forward edge of innovation. So I think those are probably the two big things: the desire to just learn and grow, and then really seeing where innovation really happens. Where I'm outside the University of Michigan right now, one of the great research institutions in the country. That's where a lot of these innovations are taking place. And I think that those are probably the two drivers of my choice that way. And maybe to your other question on kind of what I've learned through, well, a few of it is one of the practical ones. It's a lot harder than it looks. A lot of times we only see in the success magazines or online the great outcomes. This is really hard work on the innovative scale, and that's really important. And then the second thing is really, it is about those around you, and whether it's the network or the team that makes this work. The science is complicated in the early stage. Who's getting the work done, so it's about being front and center and importance to that. And I think maybe just even though my comments of saying how much harder than it is, the other practical reality is that you can figure it out with the right team on the ground. You can figure it out. Sometimes the science may be too complicated, but at the end of the day, you can figure it out. Hopefully that gave a little flavor to your question.
Right. Does make sense. So there's a little bit more freedom and flexibility, can move at a quicker pace, is what I'm hearing, and am able to get in and solve the problems that leading edge that maybe the bigger companies weren't tackling is what I'm hearing.
Yeah, I think there's a big shift in healthcare, certainly. And you see it in other industries too, even whether it's technology or defense. You see a lot of the small early stage startups taking things to a certain time period, and then the big folks take it from there, usually acquire it to move it forward.
Right. Yeah. So David, you've led both large organizations and early stage startups. What are the biggest leadership differences between those environments?
Sure. I think maybe a few thoughts on that. I think, in essence, there are some critical principles of building a team and leading, whether it's large or small, that are really important on consistent. But I would say the one big difference is the pace and clarity of decision making. Many times in a big company, whereas with, a lot of times you got a matrixed organization, and all right, who's really owning the decision? And oh, by the way, we could probably just wait until the next quarterly operating plan to make that decision, because there's a lot of risk in big companies making big sweeping changes. You have a big base business, all of that. And I think the change or difference to that in the early stages, you can make quick decisions real quick, and you have to be very clear to implement those decisions. So I think that pace and clarity of decisions is a big fundamental difference. And then the other one touches maybe a little bit on this whole idea of matrix organization. Not, in a small company, Leeanne, there's just no place to hide. You know where the work is getting done. You don't have a big team. It's not like, hey, well, this sub team over here is working on this and they didn't deliver it. Like, you got 4 or 5 folks sitting around the table. You kind of, there's no place to shift blame or to hide. And I think those are two important things. One, from a leadership standpoint that you asked about. I mean, I think one is a leader, clarity of decisions, timely decisions. The team needs that. You have to make those. But then the other part is when no place to hide on an early stage is you need to be a supportive leader, knowing that, what does the team need? What does an individual need to be able to support them? Because at the end of the day, the accountability is pretty clear. And as a leader, you want to drive that accountability, but you also want to be supportive with it.
Right. So basically, in a bigger organization, there's more levels of the hierarchy. There are more, not only for getting things pushed through and approvals and that kind of thing, but also for placing blame. If something gets held up, you can always, point the finger. But if there aren't all of those layers, then, and it's just you, then it keeps you accountable moving forward because it's on you.
I think that's a shift too, where, what people desire in their own journey. Sometimes a bigger team, matrix accountability is where people may feel they thrive better than somewhat being in the chair, having to get the work done.
Right. Now, looking back, how did your personal sense of mission evolve from military service to healthcare innovation?
That's a good one. I think, part of it all stems a bit from, I'd say, a purposeful calling to serve something larger than yourself. That military calling around, certainly in the U.S., to defend freedom and be a part of that is certainly a very purposeful calling I felt early on. In somewhat of a very similar way, I see in this journey now of being on the forward edge of innovation and in leading biotechs. It's very purposeful work to try to propel innovation to alleviate pain and suffering. ONL Therapeutics, we're in the focus on eye disease. Many of these patients are on a slow path to blindness, and that's a huge fear for patients to be healthy but losing their eyesight. And so in a very similar journey, I think for myself, I kind of get energized and rallied towards that calling, something bigger than myself. I saw that in my time in the military, and I feel like that's been a very similar transition to innovative biotech work.
Yeah. So it's just that it's rewarding to help others outside of yourself is what I'm hearing, is to serve and protect in the military. And then with ONL Therapeutics, it's tackling one of the most complex challenges in medicine, like you mentioned, which is protecting the retinal cells from degeneration. How did that mission begin? Tell me more about the foundation of your mission with ONL?
Sure. So, like many things I maybe said earlier, that in terms of innovation, at least in the U.S. for healthcare, a lot of this stems out of brilliant clinician scientists at leading academic universities discovering that. So, our technology at ONL came out of our founders' labs. Dr. David Zacks is a retina specialist at the University of Michigan, clinician scientist, and it was David's initial calling when he was treating patients for conditions like retinal detachment, age-related macular degeneration. Really got tired of having the conversation with patients saying, there's really nothing more I can do for you. We've tried all the existing treatments. You're on a slow path to blindness. That problem, that frustration drove David to work literally day and night in his labs to figure out, why is that? Is there a way to protect these retinal cells? And that ultimately gave the birth to David's discovery of this receptor on retinal cells, and then ultimately the building of the company. Certainly talk more about the technology, but it's that clinician-patient interaction of not having another tool in the toolbox to prevent disease or slow the progression of disease is what really motivated the birth of ONL Therapeutics, like many other companies in the healthcare space.
Yeah. So I know the technology, the science behind your technology is groundbreaking. Can you explain how this discovery changes the approach to treating vision loss?
Sure. So we are at ONL Therapeutics, will be described, we're back of the eye focused. So the retina is in the back of the eye. Some people think with eye disease, it's all about glasses in front of the eye. There's two sides to it. We're in the back. And retinal cells in the eye, unlike skin cells, you kind of scratch a few away, you regenerate those. In retinal cells, you have a limited amount. You don't create new ones. So when they die, you just begin to get really literally black patches in your vision until you have total darkness. And
Oh,
so
wow.
what David discovered is there's a receptor on retinal cells called the FAS receptor, FAS, in that when the eye is under stress or one of these diseases, that receptor gets activated, it triggers the death of that retinal cell. So in David's discovery and then subsequently the birth of ONL Therapeutics, we developed a drug, basically scientifically, it's a small peptide that's delivered via injection into the eye, and it blocks that receptor from getting activated. So the retinal cell doesn't realize it's under stress or disease because the drug is blocking that activation. And so in a very simplistic way, Leeanne, our drug blocks the activation of that death pathway, which protects that cell, keeps it alive. And then we typically also, in the process of doing that, quiet any inflammatory response. And so by virtue of that, it protects those cells. And quite simply, the more retinal cells you have, the better you're going to see. And we hope we can protect patients that way.
Oh, wow. And so it's an injection into the eye. And how long does the injection last?
No, great point. So many of your audience that may not be familiar with some of these conditions, nobody likes to think about a needle in the eye. But
Yeah.
the reality is, for conditions like wet age-related macular degeneration, it's been a quite common procedure for people to administer a drug directly to where the target tissue is, in our case, the retina, with an injection in the eye. So with ONL's lead compound, we're injected every 3 months or every 6 months. So we've got some spacing between those injections. There are other products on the market that are injected every month. And so we think there's not only a differentiation, but also a patient benefit to perhaps not have to go into that procedure as many times over the course of a year.
Yeah. But I understand. I mean, injecting into the eye isn't painful, is it?
Well, I personally have one. However, the doctors, you do numb the eye up a bit, but there's
Okay.
certainly a degree of pressure that patients feel.
There's some pressure.
And
Okay.
I think they try to do a good job of numbing it up. There's millions of injections done over the last 20 years in conditions called wet AMD. So there are
Uh-huh.
risks associated with it, but I think the medical community has done a really good job of protecting patients from many of those risks. So,
Right.
but nobody I think signs up for it voluntarily.
No. But I know even like with LASIK treatment, I mean, it's not really a painful procedure. I mean, it's uncomfortable to keep the eye open,
Right.
but from what I understand, I mean, they're actually like making incisions and cutting into the eye,
Correct.
and it's not painful, but it
More
not comfortable necessarily, but it's not. interesting anyways. I didn't know how similar that
It is
would
a
be.
bit similar. I think that, the opening up the eye and maintaining that is probably the most uncomfortable kind of weird,
Right.
weird feeling, so to speak. But at the end of the day, I think what I've learned in this journey is that if patients can forestall the loss of vision, they'll do just about anything they can. And that's where we feel like
Oh,
it gets it
yeah,
right to the
definitely.
right tissue. Yeah.
Yeah, yeah, and a small procedure like that every 3 to 6 months. I mean, I think that is worth it if you can maintain your eyesight. So I understand you're now in phase 2 clinical trials. What's been the most exciting or challenging moment of that journey so far?
Sure. So, we've run, this is our fifth clinical trial, so our fifth human trial. And I think the normal progression for folks to understand is phase 1 trials are safety. Phase 2 is really trying to prove safety and efficacy. So I think with this current trial, we just announced first patient dosing. So I think the challenges on the trial are this is a large global trial, 325 or so patients, US, Europe, multiple countries, just the complexity of aligning study protocols with all the regulatory parameters that are sometimes slightly different across countries around the world. It is operationally a very complicated study to implement by virtue of size and scale. So I think those are the complicated items. The real kind of inspiring part is just what I shared earlier. We dosed patient number 1 just a day or so ago. Just knowing that we're making progress in the trial to do that is just incredibly exciting. We think we obviously need patients to move the program forward. And I've come to really appreciate, Leeanne, that patient number 1 in each one of our trials is a special individual
Yeah.
because the
Yeah.
conversation is like, hey, you'll be the first one in this trial. How's that feel? And some courageous patient signs up for it, which we're very grateful for.
Right. So out of curiosity, how many patients are involved in each trial?
It varies by indication. So in our phase 1 studies, anywhere between 25 to 30 patients in each one of those. We ran 3 different indications for phase 1. Phase 2 is typically when you need statistical power to show safety and efficacy. So that's where we get big numbers. Our first phase 2 study was about 160 patients. This phase 2 study we're running right now is 325. So pretty big
Okay.
number.
Yeah.
And
Yeah.
what we hope it can do, though, is show the potential to impact millions of patients have this condition down the road to be able to treat.
Right, absolutely. Now, clinical trials, like you mentioned, I mean, they're pretty involved and they do require extraordinary investment in patients. How do you keep your team motivated during such long and uncertain processes?
It's a really great question. And it's also, I think fundamental too to leadership. It does come down to that purposeful mission again. We have our vision at ONL is to help patients see the future. So in times where you're working through the long slug of what we're about, and I'll call it these dark journeys of just trying to really implement the trial, it's important to reinforce to the team that long-term purposeful view that we're going towards to build some energy around that. And then I think the second piece to that, Leanne, which I think I've come to appreciate over the years in my own leadership, is that it does come down to one-on-one with individuals on the team, making sure they see how their part in that journey is important. What they do every day ties to that longer term mission. It reinforces to them that they matter to the team, to the company, and they begin to really think of themselves mattering to the mission. And so that is what I found is very motivating for folks through these kind of dark parts of the journey and the occasional setbacks, which happen as
Yeah,
well.
right. Yeah, and speaking of setbacks, you've experienced both major exits and hard setbacks. How do you personally define success in such a high risk, high reward industry?
Yeah, it is high risk. And, I think one of the takeaways I have is, not all these technologies make it. That's the practical reality. As I may have mentioned earlier, most people only hear about or see the Instagram highlight reel of the successes that most of those technologies don't make it. So I think for me in this field, success does boil down to moving the science forward. At ONL, we think we have the potential to make a real difference. But, odds are we may not make it all the way, but we hope we carry the science forward enough so that somebody behind us or to the side of us can move that science forward for patients. I think that's a really important part of what I would say is a successful venture. And then the second piece is also, it does come down to the people. Success is seeing individuals reach their full potential, grow in their roles, take on additional responsibilities, all in the name of moving the science forward. I think those are probably two areas I define success, because you're right. I mean, the other ones, whether it's financially, a big acquisition or IPO or commercial success, they happen, but too few. And I think at the end of the day, moving the science forward and seeing people develop to their fullest is are really cool hallmarks for success in life sciences.
Yeah, right. And I like that because, I mean, even the big successes often they piggyback on smaller successes. And even if, right, something doesn't make it to market, there's learning and there's science that's built in the process, and other innovation can build off of that. So I think there's always learning as long as there's that movement forward and you don't give up and you still are determined to reach that ultimate goal, which is helping people, which is solving a problem. And in this case with the eyesight, like you mentioned. So
Certainly.
having that bigger goal in mind. Yeah.
It helps. It's nice to have the commercial success and all those things too, but it's few and far between.
Yeah. Well, and understanding that risk, I think, going into it too, it's just establishing those expectations and understanding what you're up against, I think helps probably, ward off disappointment, if you would, but I guess it's probably still there.
Right.
Now, in biotech, innovation often depends on investors' trust and timing. What advice do you have for founders navigating the balance between science and business?
Sure. And I think that a couple things I'd say is that at the end of the day, the science, the technologies, the development of these is pretty complicated, but you have to start off with a clear plan. It may not be perfect for all scenarios, but you need a clear plan, and you need to begin to communicate that plan, not just to the team, but you mentioned investors and other stakeholders. As you execute the plan, the communication of that plan is important, because inevitably, kind of what I said early on, some data point's going to come back that you weren't thinking about. And you'll need to then either adjust the plan or at least communicate that data point that was not either a pleasant one or not part of the plan, and then what you're going to do about it. So I do think, at the end of the day, my advice is you can talk about how cool it is to build a company with 3 or 4 people around the table and make decisions. At the end of the day, you need a plan. You need to execute that plan. And very much for investors and stakeholders, communicate that very consistently, so that inevitably when you get a surprise, you hopefully have a good surprises, but you're occasionally going to have a few bad ones, that you just can methodically weave that into the communication and then potentially adjust the plan. I think that over time builds a level of reliability that ultimately translates into investor confidence to want to invest in the business longer term.
Right. Yeah. So I'm hearing just like really good communication, consistent, and communication transparency between all stakeholders involved is the key to moving things forward. Now, back to like talking about those failures. While painful, as we mentioned, it still moves the science forward. How do you maintain perspective and resilience when things don't go as planned?
Well, I think part of it, by virtue of me being in this game for a while, it's a little bit over 30 years, you do have a realization that it is part of the journey. You just, inevitably, the science may be at the time too complicated, or the commercial execution just doesn't go right. So I think, part of that is just realizing it is part of the journey. Let's face it, nobody signs up this thing to make mistakes and fail, no doubt about it. So you come after it every time with a sense of positivity and belief you can make it happen, but sometimes it just doesn't work out, and that's the reality of it. The other side of it is why, this, especially in the CEO role, but in all I'd say senior levels and leading biotech, it's still a lonely grind. And the importance of having a nice, trusted network, a few colleagues who have either been along the journey with you or ones you can lean on, I've found to be very helpful, because I do spend a lot of my time speaking about the confidence in our plan, the ability to execute. But every now and then something doesn't go too well. And I think during those failures or setbacks, having some good trusted advisors to rely on to just really put it all out on the table in a probably a bit of a sloppy manner, but just to get it out there and have somebody say, hey, it's okay, we'll pick up the pieces. That I found that to be extremely
Yeah.
helpful, and I try to do that for others in this game.
Yeah, and that is good advice, and it can be lonely at the top, and finding people who relate with you and your same, struggles, like as a CEO, I think is important. How do you find those people? Are those people that you've known for many years? Are they networks of people, or is there a certain space that you find them in?
Yeah, that's a good question. I think for most people in life sciences, you do try to be a good player in the field, and share experiences with others. I found like a lot of these things, sometimes you come forward with a spirit of giving and helping others, and before you know it, you're needing on the receiving end. And many times those folks are very gracious to return the favor, And I
Yeah.
think that's been an important part. But I'd say, I didn't fully appreciate the value of an external network when I was with the big companies. You realize that another part of being out there and exposed on your own in these early stage companies, you realize the value of having a good network. So I've been very intentional on trying to build that. I think it starts with just trying to be a good player in the field. I've been fortunate enough to have a few people that have wanted to journey alongside and help out.
Okay. No, I like that. Yeah, just being a good player when you're out there, and then building a network of trusted people that you maintain relationships. And I guess it's just being intentional about maintaining relationships throughout the years.
It's
And
important. It's gotten a little bit easier these days with social media hello, where before you'd end up spending most of the time dialing somebody's phone number, right? It's a little bit easier these
yeah,
days.
yeah, that's true. You can see, yeah, there's more visibility. You can see what people are up to without having to
Right.
reach out necessarily. So now, David, what role does humility play in leading through uncertainty, especially when the outcomes are literally life-changing for patients?
Well, I think it is a bit of a humble journey by virtue of the fact that, as I mentioned earlier, it really doesn't go as planned. I speak to so many people in this space. Rarely ever does it go according to plan. So I think that it just comes with, if you're self-aware and thinking through it all, it's just a humbling journey. The science is complicated. The disease states are complicated. That's one element of I think why it's important to come forward with humility. The science kind of forces that on you, but I think the second
Yeah.
problem is reason is a little bit more practical. You can't do this alone. You need a team. Our team at ONL, we're a small shop, but every individual brings a different perspective to the table. But ultimately that helps us move this complicated science forward. You need investors to it. It's a team sport. And I think that anybody that maybe carries a degree of arrogance in this field doesn't fully realize that it's a team effort. Again, the media may highlight these folks who's just one person that's kind of taken on the world. The reality is there's a good team supporting that, and I've
Yeah.
certainly lived that. So that helps you stay humble in this sport.
Right. Yeah, that's true. I mean, because I think arrogance that, it ends up pushing people away and shuts people down. And having that team spirit keeps people open. And if you're sharing the wins and the credit, it motivates people to keep at it, and they feel acknowledged and valued. Now, beyond science, ONL's mission touches something deeply human, the desire to preserve sight and quality of life. How does that purpose shape your culture and leadership?
Wow, it's a good one. Well, I think it's human sight is precious, and so I think how that really translates into the culture and my leadership, I would say it's really foundational to everything we do. When you think about the precious nature of human sight, you make sure the level of quality in our product is at the highest level. The level of attention to detail in the clinical trial that we're running, the checklist, the protocol, the manual of procedures that our clinical operations teams put together, the level of attention to detail and accuracy in communicating that to study sites. I think that's where the principles of what we're trying to take forward really get hold, because something is trying as precious as protecting vision. It gets to a level of energy that we need around this, the attention to detail, and just a high bar of quality We don't want to make any mistakes when it comes to patient's vision and how we. So I think how that ties to culture and leadership, I think it's kind of foundational for what we're trying to build.
Yeah, I know that makes a lot of sense, right? Yeah, you want to make sure it's all organized and documented, that science is well, founded, and that, I mean, because like you said, I mean, you're dealing with people's eyesight, and that's not something you want to take lightly. Yeah.
Totally, totally. Yeah.
Now, David, you also founded Harvest Time Partners, which focus on personal and professional development. How do those principles show up in how you build teams today?
That's a good one. No, I appreciate you mentioning that. I've part of the Harvest Time Partners, I've written a handful of children's books called The Principles of Our World, things like courage and sacrifice, compassion. It's kind of funny, Leanne, when I wrote those books, and I've still written a few of them, I learned just as much, even though they're children's books designed, for parents to guide kids. Those embody what I want in a team and my own leadership. You want people to understand this idea of sacrifice for a larger good. It's really not about me or you or an individual. It's the cause we're really pitching in to deliver on. And that's really important about it. And I think those principles of like compassion, that you'd want a child that you're reading to boy, understand compassion and how they treat friends. It's the same way we think about it here. You mentioned patience and the sensitivity of it. We ought to be compassionate individuals to those patients, but also having led a number of biotech companies, you need some compassion in the workplace. This is high stress stuff. We're all overworked. We're raising capital to move the programs forward. We keep our teams lean and small because we're trying to make the cash runway last enough to get the trial going. You need a degree of compassion as a leadership team because people are running really hard. So I think anyway, that those children's books and those principles are a lot of the development things in Harvest Time Partners. It's obviously a part of me, and I think they're relevant to adults just as much.
Right. Well, absolutely. And we all learn through stories. Everyone loves a good story, a good movie, a good book, right? It's all about stories because then we can relate to people or to the characters. And for children to start cultivating those skills at an early age, to, like you said, start developing compassion and empathy and the human connection skills is really, really important.
It's tough today too with everybody's fighting these phones on and off, and it's a hard one to just either rebuild those skills in adults or build them from the start with kids, because we're all fighting this electronic stuff just the way it is.
Right. Well, and that's true. I mean, we often forget, or it's easy to forget, I think, when somebody's on the other end of a screen,
Mm-hmm.
that it's a person, that
Yeah.
these are, when you're responding to somebody's comment, that's an actual person that you're, responding to, and they're going to read it and they're going to feel a certain way about it. There's going to be an impact. So, yeah, it's important reminders, I think.
Right.
And finally, as someone who has led in combat, in corporations, and in startups, what's your advice for leaders who want to lead with both courage and compassion?
Sure. I think maybe a few things. One is, at least in my world today too, and part of a big company, but it real kind of shines a light on the small companies. You got to figure out where you're going. Just like in a military sense, like what's the mission? Where are we really going after? You ought to be really clear on where you're going in that direction. That ultimately creates this sense of purpose for people, whether it was in the military or here in a biotech. So that like unifying direction is a really important part in a tie, at least for what I think can guide leaders to do, is like, where are we really headed? Because that ultimately becomes the rallying cry, whether it's the why or the real purposeful work. And I think the second one, although it's hard not to say, hey, then you got to make the plan. How do you get there? So building that plan would be one. But I think that although that's important, there are plenty of books written about it. I think the one I've come to appreciate just as much on setting direction, I mentioned it a bit earlier, is that to really get at a personal level on ensuring people know their role to that long-term journey, what they do every day is meaningful towards that journey. They matter in that journey. What do they need as support to keep them going in that journey is important. We want people to know they matter to that journey. And I would say those would be the two things to cast out to folks, is make sure you're clear in where you're going, because that becomes that purposeful rallying cry. And then that second one is really around making sure people know how they fit into that so they can
Yeah.
see themselves mattering quite a bit.
Yeah, you need the mission and have the passion for the mission, but you also do need the buy-in from the team, and you need people who are committed to that mission and standing behind it. And the more they understand that they are valued and they make a difference and that they're an integral part of that mission, I think the easier it is to get them to go alongside you and create that alignment. Yeah.
And to that point, Leanne, yeah, it takes time to do it. You got to
Hmm.
sit down as a leader one-on-one. To the point you made earlier, you can't necessarily say that over an email. Sometimes you need to sit and feel somebody breathing next to you and really kind of make sure they know they're important to the role.
Exactly. Yeah. Well, David, thank you for such an insightful and inspiring conversation.
Oh, Leanne, thank you. It's a pleasure being a part of it.
Of course, of course. Yeah, just it's a good reminder that leadership is about discipline and vision and unwavering commitment to serve others, not just to um, create a product or a service, but it's really about serving the people. It's about the people that you're going to impact. Now, for listeners who want to learn more about ONL Therapeutics or connect with you, where can they find you online?
Sure, certainly on our website, onltherapeutics.com, and on LinkedIn, they look up David Esposito. I'd love to respond to that. My mobile phone's on every book I wrote, so they'll be able to track me down, and I'm glad to pick up the phone and have a conversation.
Excellent. And to our audience, thank you for joining us. Be sure to follow and subscribe to Industry Ignited for more conversations with leaders shaping the future of industry and innovation. Until next time, stay bold, stay curious, and keep igniting industry.